So, continuing on with CPR for children, now that you've seen the video, we want to first make sure that we're always safe. So, looking very quickly around the scene to determine what happened. Is it safe for you to enter? Or even do you need to get the victim out? Is it a dangerous situation? If it's not safe, we do need to just call 911 and wait so that the firefighters can come in and deal with that situation. But if we're able to help, the next step is assessing for responsiveness, tapping, hey, are you okay? If we know the child's name, calling their name, yelling loudly. If there is a response, even if they're not speaking or mumbling, if they move around a little bit, if you get response even to some pain or some stimulation, then we can wait with them and again call for help and wait with them to assist in case anything else happens. If there's no response, though, we need to check, are they unconscious? Are they not breathing? What exactly is going on? So you're just going to get close and try to determine if they're breathing. They should look like they're sleeping. And we've all seen a child sleep. So we're just looking at their chest or their belly or their face to see, hear, feel anything that's going on to indicate normal breathing. If you just see one gasp or one breath every 30 seconds and it seems like, oh, that's way too long, that's not normal breathing. They don't look like they're sleeping, but they're breathing. That doesn't count. You need to just trust yourself. If they don't look like a normal sleeping child, they're not breathing. Even one breath every 30 seconds, that's not enough to sustain life. So we can definitely still do CPR in that situation. So if you haven't already called 911, you want to make sure that you have called at this point. If you have a cell phone, you can do that on speakerphone and just do all of these things simultaneously. They don't have to go in a certain order. But if you've determined that a child is not breathing, we need to start CPR. You can do 15 chest compressions and 2 rescue breaths. When you're by yourself, you can do the 30 chest compressions and 2 rescue breaths, which is the same as adults, the rate. And then once we get to 2 people, we have 1 person doing breaths and 1 person doing chest compressions, and we can speed it up with this 15 and 2. That will give them more respirations per minute, which is important for children since they are more likely to have a respiratory problem that is causing cardiac arrest versus the other way around. So we're going to continue at that rate until one of these things happens, until help arrives, another person arrives that can do CPR, you see signs of life, the scene becomes unsafe, or if you're too tired to continue. For infants, we just have a few differences. We're going to tap on the bottom of their foot. So you want to take off whatever onesie or socks or shoes that they have on because they're going to get a better stimulus down there than if we tap on their shoulders. If they're still newborns and kind of squishy, that's not going to do much to them. Everything else the same. The chest compressions, we only need to do a few fingers. Okay, you can do 2 or 3 depending on what feels best to you, and just straight up and down on that chest bone. For adults, the only difference, like I said, is we're going to stay on the 30 and 2 because they're more likely to have a cardiac problem. So we need more chest compressions in that situation. For every age that we would be doing chest compressions, we're always in the center of the breastbone on the sternum. So in between the nipple line, and compressing at a rate of 100 to 120 compressions a minute. The depth is talking about how far down we're going to push if we're pushing, doing chest compressions on their chest. And if you look at the rates here, it just means the bigger the person or the older the person, that is the deeper that we need to go. So an infant, we're not trying to push 2 inches like the whole way through that child. It should be about a third of the chest. So think of pushing halfway down, but it's less than that. So less than halfway down. We saw in the video doing a head tilt chin lift, which is exactly what it sounds like. We push on the top of the head and push that down while we lift the chin up. You may need to do a jaw thrust, which just means pulling the jaw out or trying to just pry open the mouth if we suspect a head, neck, or spinal injury. We should only be doing mouth to mouth on a loved one. If we're putting our mouth directly over their mouth, and sometimes you have to put it over their mouth and nose if they're an infant. But if this is a stranger, hopefully you have a pocket mask, a CPR mask available in your first aid kit, and you could use that to protect yourself against any viruses or diseases. So we're going to deliver 2 breaths, each lasting 1 second, and watch for the chest rise. So we are tipping the head back and doing 1 breath and blowing in and looking down. The chest should go up. If it doesn't, you can reposition and try 1 more. If it doesn't look like it's working after 2, that's okay. We just keep moving on and go back to the chest compressions. The chest compressions are the most important thing. So even if you skip the rescue breaths entirely, like this is a stranger, you don't have a CPR mask, you can just do hands only CPR, which is just chest compressions. So for choking, most of you have seen that, we're going to wrap our hand around people, make a fist, put our flat hand on that, and you're reaching up under, their rib cage where their stomach is, and that's an abdominal thrust. So we're pulling back, we're wrapping our arms around them and pulling back and up as hard as we can. So we can do that with adults and children. You can kneel behind the person if they're shorter. They can be seated. You could be standing. We can be different heights. That's okay. We just want to be reaching around. Now, if we have someone that's obese and we can't reach around, or they're just very much bigger than us, they can try to lean on your fist and hand combination. Or if it's a pregnant person, that's very pregnant at the end of their pregnancy, and you really can't get your hand in between the rib cage into that abdomen, you can go ahead and do the chest thrust that we're going to see on the infants. So a chest thrust is the same as a chest compression. So on infants, again, if I have a baby small enough to hold, it's under 12 months, that is what we're classifying as an infant. And if I push on their little stomachs, again, they're so squishy, it's not going to do much except just jiggle things around in there. So I need to be a little bit higher up on their rib cage and do the chest thrust. So we'll take a look at this quick video for that.
If an infant is conscious but choking, deliver 5 chest thrusts using the 2-finger technique, thrusting the infant against your forearm and thigh. Turn the infant over and deliver 5 back slaps. Continue alternating 5 chest thrusts and 5 back slaps until the airway obstruction has been removed. Make sure to support the infant's head and neck when delivering the chest thrusts and back slaps. If the infant becomes unconscious at any time, begin CPR.
All right, so looking at our topic of the month, we have been looking at different topics every month. So you'll see a few of those on your PRG resource page if you want to look up past topics. Injury is the leading cause of death for children from age 1 through teenagers. For infants, the leading cause of death is still respiratory, so sudden infant death syndrome situations where the infant would stop breathing. But this month we are going to look at foreign bodies. So things that get poked around anywhere on your body that are not supposed to be there. So, how do you get them out? Well, it depends. Things that are small, generally speaking, you can get out with tweezers, and that falls into the splinter category. Larger things, you're not going to touch, not going to pull out, especially if something is impaled, a pole or a piece of glass, and it just looks deep. You don't see 2 inches of the object. Don't pull that out. It is stopping bleeding. It's keeping compression on whatever it has cut. And the second you pull that out, we're going to have hemorrhaging. So don't touch it. The basic rule is wrap things around it. So if you have a big cut on your arm, you're just going to wrap gauze on the sides of where the object is, not over top, and just try to stabilize that situation. If you think you can get a ride to the ER, if it's too big to move, we were just calling 911 and waiting, and trying to assess for any bleeding. So with kids, we always have special situations. Kids stick things in all kinds of places. So putting little things up their nose happens all the time. Pediatricians are quite familiar with taking those out. If you can see it and grab it with tweezers, you can do that. You can also try to get the child to blow their nose, whether they can do it normally, or if you hold one side for them that doesn't have the thing in it, and you try to get them to blow it out, even telling them that you're blowing out a birthday candle with their nose, even if you need to, bring out a candle as a demonstration. Just try to work on getting that to happen. If it is up too far, you have the possibility of that going into the sinus cavities, which are just holes that we have in our cheeks, but they go up inside our skull and our forehead too. And you don't want that to happen. I've taken my kids myself. They've stuck little plastic things up their nose and in their ears. At the pediatrician's office, they do have surgical tools that are longer tweezers. They have little cameras, they have lights, they have, more tools to get these things out. So sometimes you don't have to go to the ER if it is during the day and you call your doctor's office. Hopefully they can say, yes, just come over right now and we'll get that out. Same thing with the ear. If you can see it and you can grab it with the tweezers, grab it and pull it out. The eardrums are pretty far in. So you really can't get them unless you're really, sticking something really in there far. But we're not trying to probe on either of these. Like you don't want to put a Q-tip and try to pull it out. You have to have a grab an edge of it and be confident that you can get it out. If we feel a bug crawling around in the ear, that does happen. You can put just any oil. It can be essential oil, it can be cooking oil, and it will drown the bug. And then you have to use gravity and try to get that to just come out in a little flood. Then, if you do have a syringe, even the little ones that we give medicine with, you can wash one of those out and just put some warm water and try to squirt. You can kind of wash out an ear that way with a little bit of force. Again, our eardrums are pretty far inside and they're solid. So as long as the child doesn't have ear tubes or some sort of surgery or something going on, and the eardrums, intact and all that, you can fool with it a little bit, just not poking. If you poke, you can poke the eardrum. So with the skin, like this picture here, if we have a splinter, we can remove that with tweezers easily. Again, if it's anything deeper, like there's more to that object, it is stopping the things that it's cut. It's stopping the bleeding by remaining there. Don't take it out. Just put gauze, paper towel, washcloths, whatever around it will kind of stabilize it. If it's something that is moving a little bit, that's going to hurt a whole lot. Again, if this is a child and they're not tolerating this at all, they're not going to be able to sit in a car holding this object, you just call 911. That is not a problem at all. For adults, if this would happen, we just need to also check that our tetanus shot is up to date. And it's called all these different things now because they changed the name. So you have several of these throughout your childhood as booster shots. And then once you're over 18, it's every 5 years. So it can be DTaP, just DT, the tetanus, or the Tdap. So it can be any different way looking on your immunization chart, but the capital T stands for a tetanus shot. So that's when you can look up and see when your last one is. It's given with these other ones, it's given in a combination. So the D is diphtheria and the P is pertussis. The little A is acellular pertussis, so it just kind of goes with the P. So also for the eye, you need to rinse. You can use water, warm water for 10 to 15 minutes, especially for a chemical. But even if you have some makeup in there or just dirt or sand, you can rinse. And just remember to put the eye with the object towards the ground or the trash can. If we go this way, then I'm putting the dirty water can run through this eye, even if I have that eye closed. A little video on eyelid injury.
If somebody has something embedded in their eye or they have injured their eye, it's important that you give appropriate first aid as quickly as you can. If there is some sort of dust that's got in their eye or a little bit of grit or sand, you can usually irrigate that out with sterile saline or an eye wash and remove it. So if when you look at them, that bit is moving across their eye and it's floating, then be ready to irrigate it and remove it for them. Encourage them not to rub their eyes. So if it's moving, remove it. If it's embedded in their eye, you want to cover both eyes because moving one eye will move the other one, and they will need to get to a proper eye hospital as quickly as you can. It will be making them feel really awful having something embedded in their eye, and they'll be very scared. But what you want to do is ideally cover both eyes, either with something like a triangular bandage or paper cups are quite useful because they can cover them without it actually touching the eyelid, and get them to an eye hospital as quickly as possible. If it's chemicals that have got in the eye, make sure that you are irrigating for at least 20 minutes and get medical help as quickly as you can, and make sure you have a look on the bottle if it's available to see exactly what you should be doing in those circumstances.
Okay, so good information there. I've been a nurse at camps and schools, and so when kids are playing outside, I've definitely seen objects in the eye embedded in the white part, which is the sclera, and or scraping the cornea, which is also very painful. So sometimes the scrape will just be a scrape, like a tree branch that went by and we couldn't blink, or a ball, and it won't look like there's anything in there, but it is very painful. And so then when they go get their eyes checked right away, the eye doctors can use special lights and look in there and tell that it was scratched, and that's something that we'll just need to heal at home. But if we have an object, I've done that paper cup trick. We have the little paper drink cups or bathroom cups, and taping that around, even if there's like a little stick or a branch, a piece of a tree kind of sticking out of the corner, you can put that over it, or even poke a hole and put it through the end. So again, kids are very scared when this happens. They need to remain still. If they can lay down while you tape up this little bridge that you're making, and what the lady said about covering both eyes, that's really helpful. Even if it's just a warm washcloth on the other one, it just helps them keep their eyelid closed, and the other one is kind of taped up. And then even if we can transport them that way, that's helpful, or just call 911 if it's too much. If it's an older child, sometimes they can sit still enough and be okay being driven to the nearest hospital if it's a few minutes away. If not, call 911. We are lucky in my area here in Maryland, because we're near Johns Hopkins. They have an IER at Hopkins that I've had to use before. So sometimes you have that in your area, which is great, because then you can get right in for that and not wait too much. The last one is a tooth injury. You've probably heard before, if a tooth breaks that you're trying to save, an adult tooth, put it in milk. And that is referring to cow's milk, not the nut milks. The cow's milk do have a certain protein in it that goes well with our teeth and helps them stay alive. So going to the dentist immediately. And again, sometimes your ER will have the emergency dentist in place or on call. Sometimes you have to know which place to go to if it is after hours. Some adult teeth can be replaced if a child falls and knocks out front teeth. Some cannot, but we'll let the dentist figure that one out. So we did review chest compressions and rescue breaths and choking. We don't use the AED too often with children because they are more likely to have a respiratory problem that is causing cardiac arrest versus adults who are more likely to have a cardiac problem, like a heart attack or a cardiac arrhythmia. So AEDs are just not as useful for children, so we haven't reviewed that today, but they are very easy to use. You turn them on. They're in most locations now here in America, and follow directions. It will speak to you and have pictures, and you just kind of match up what it's saying to do. And as long as you've called 911 and help is on the way, you can do that. So we do have a special code for you, and you're going to go to the savealife.com website. And what you can do is grab the CPR course and put that in your cart. And the CPR course, let's see, oh, I did have a different code on there. The CPR course does include all age levels and has AED information and choking. So you guys are going to use Helpr CPR, HELPR CPR. And when you hit redeem code, it will bring your price down to 0. And how this works is you go to the website. You only have to make an account using just your email address, pick CPR, put the code in, go through the course. There is an exam at the end, and you can log in and log out. You can complete this at your own time, take as much time as you want. When you pass the test at the end, you'll be able to instantly download and print your provider card and certificate. So it will say your name and that you are a CPR provider, and that is good for 2 years. We do have other free resources up here, just to let you know to look through. There's a free mobile app that's on your app stores. It has all the courses, and you can look things up on there. And we also have free handbooks. These are full color handbooks. So if you want to download a CPR book, has all the first aid in it, you can keep that on your computer, or you can print that out. So that's all I have for our webinar today. And I hope you did learn something, and I hope to see you again soon here at savealife.com.